Page 330 of the PCCM. Skin problems, tinea, versicolor, or pityriasis, versicolor. Now, just to go back to the basics and remind myself, anything, what pityriasis versicolor is. It's a common condition in children and teenagers caused by yeasts, so Malassezia yeasts, which are normal commensals of the skin. It's common in tropical climates and exacerbated by heavy sweating. And it looks like this. Typical rash presents as a well demarcated small patches of hyperpigmentation with a fine scale. You can see that there. It usually presents on the upper trunk in teenagers, but in prepubertal children it's often the cheeks and temples, where it can be easily mistaken for dermatoses such as pityriasis alba. It's usually asymptomatic, and the most patients complain of is a very mild itch. Treatment is usually requested for cosmetic reasons. Diagnosis is made by skin scrapings, which reveal spherical budding yeasts and cause mycelia on microscopy, but the clinical appearance is usually diagnostic anyway. This is easily treated with any imidazole cream. However, 2.5% selenium, such as Selsun, is also effective. You can also treat it with oral agents such as fluconazole or itraconazole, but it's rarely required. Things like Grezio-Solven are ineffective. The rash is hypopigmented. This may persist for some months until adequate sun exposure repigments the areas of pallor. Pityriasis versicolor is often recurrent, and repeated courses of treatment may be necessary. Alternatively, using selenium or ketoconazole shampoos weekly in the shower will be effective as a preventative agent. That's interesting. So the PCCM recommends for tinea versicolor to perform a skin scraping for microscopy and mycology if there's doubt about the diagnosis, and apply selenium 1 or 2 times a month after initial treatment to help prevent recurrence. So the presentation is, as we kind of talked about, may present with a well-defined, irregularly shaped macules. So flat, macules are flat. And the macules vary in colour from reddish-brown to hypopigmented lesions. They're covered with a fine scale and most commonly found on the upper trunk, neck and shoulders. Itching is usually mild but may be more marked after swimming in salt water or heavy sweating. The assessment is obtain a complete patient history, OBS, nutritional status, look at the whole skin. Management, you want to perform a skin scraping. The cheapest, safest and most convenient treatment is the selenium. Alternatively, you can use the azole creams. Ketoconazole 2% shampoo, miconazole 2% shampoo. Notify the MO if not responding. So from the medication list, selenium shampoo 2.5%, leave on for 10 minutes and wash off and repeat daily for 2 weeks. You can use ketoconazole shampoo 2%, leave on for 10 minutes and wash off and repeat daily for 10 days. And to help prevent recurrence, reapply the selenium shampoo 1 or 2 times a month.